Welcome to Startup Health TV. This is a special COVID-19 health innovation update. I'm Logan Plaster, editor of Startup Health magazine, and I'm joined today by Mario Anglada, CEO and founder of OI Health. Mario, thanks for joining me today.
Thank you, Logan, for the invitation.
Mario, what we're doing with these health innovation updates is really talking to entrepreneurs about how they are reframing, pivoting, refocusing during the coronavirus pandemic. Now, I know that OI Health has done really interesting work, important work in opening up access to care, particularly to under-resourced communities. And I want to hear kind of where that's at. And I know that you also have some very recent updates in terms of how you are pivoting those offerings during this time. So give me a quick synopsis of the kind of the core product as it stands right now, and then we can talk about kind of what you're doing in this moment to address the coronavirus.
Absolutely. So OI Health, as you might remember, is a complete primary care platform. So primary care is 90% of your medical life, as we all know, and it's also an area that has a lot of challenges because my patient base as a doctor is huge. My data back feeds to me as a healthcare provider are immense. So there's a big disconnect between the ability for a patient and a doctor to have a meaningful relationship over the course of time. Let's say that I'm managing a patient as a diabetic. I'm going to be managing that patient for the next 5, 6, 10, 20 years. So what we've tried to do over the course of the last 2 years, create an end-to-end solution that would grasp to 3 main concepts. Number one, we would want everybody to have a doctor, right? So the idea would be, how do I get that doctor and that patient connected? And obviously we launched our telemedicine that we can talk a little bit more about in a minute. The second thing was, now that that doctor has that patient relationship, how do we get low-cost medications into the hands of patients? And we've historically had 2 products in the market, our discount card OI Meds and our prepaid voucher program OI Rx. So those 2 are complementary to the doctor engagement. The last element that we saw, which was a critical element, was the ability to provide what a chronic condition sufferer needs. So think about the ability for me to be able to put a glucometer, a weight scale, a blood pressure cuff into the homes of a patient, capture remotely data from those biometrics that those patients need to provide back to the physician, and do it in an automized fashion. So the OI Health platform is those 3 elements. And last week we launched the telemedicine component of it. So we've come full circle, and now we can treat patients with no insurance needed in the 3 methodologies that I just described to you.
Talk to me about the fact that you're addressing populations without insurance. Why was that important to you, and how did you go about making the model work for that community?
Absolutely. So that's critically important for us, because if you look at the underserved medical community in the US, you're talking about 36% of the population. That's 118 million people who have, for all practical purposes, no health care. What we said is, can we devise a method where those consumers come to a service, and that service is low enough in terms of cost for them, where they can engage in self-pay? If they can't do it themselves, could they aggregate funds from a family group to be able to pay it? And what we focused our product services was on getting that core of the core consumer into our ecosystem. Because if I can get a very low income consumer to use our products and services, that means that the price point is then going to be attractive to those that have health insurance, to medical plans, to Medicare, to Medicaid. But by going it from the perspective of the uninsured low-income consumer and creating the product solution, from there it goes to anybody else. So we were consciously prescriptive on being able to solve the needs of that subset of the population. Now that it works for them, it works for everybody else.
So you want to be a go-to source of medical care, primary care, for the millions, tens of millions of people who are now unemployed, finding themselves without insurance. If they have a sort of a routine problem, walk me through the patient experience. Do they go through your main website? Does it go through their provider who's a partner with you? How does it work?
Yep, so it works in various ways. So the first and easiest way is a consumer goes directly to our website. So you go to oihealth.com and you're going to see our product offerings available to you. You select, I need to see a doctor. It'll take you through our telemedicine. I need medication, it'll take you through our medication programs, or I have a chronic condition and it takes you through your chronic condition journey. The reality is that we're working directly with consumers through social media mostly, but we've seen that in these times of need, a lot of the healthcare professionals that we were working with in partnership have pivoted their engagement to a completely virtual solution. So what we've done in the short term is we've made our platform available to any healthcare professional who wants it. So if you have a patient base and you need to bring those patients to a platform to be able to have turnkey telemedicine, we're offering our solution to all of those. And we've been lucky to have a lot of partners to see the value there. The second element that we were able to bring together was that of going into pre-existing relationships with federally qualified health centers, with medical insurance plans and the like, and expose our end-to-end solution during a time of the pandemic. And let's step back and think about what's happening in the healthcare system. You have vulnerable populations, 65 plus seniors, and those that have chronic conditions as the very vulnerable populations for the whole healthcare system. Because if I am a comorbid hypertensive and diabetes patient and I get exposed to corona, that's going to be detrimental to me and to the system. So what we've been working with and through our partners is to create a model where we're able to deploy our solutions to the patient's home, and they can monitor those patients at home and determine through our tool set when it's time to bring that patient into an institution, and taking a risk-based assessment of doing this at a distance. So we're seeing a lot of traction there. We're working with federally qualified health centers specifically, and with two medical plans on both sides of the US to make this a reality today.
So you've made access and cost really hallmarks of these products. What kind of decisions have you had to make to keep costs low enough for this to work?
So one good point is that we're building a basic business model concept of economies of scale, right? So economies of scale work if you have a per widget cost that is very low. So what we've been able to do is, instead of trying to find, let's say, 10 or 15 partners that provide supplies in our glucometers or our pulse oximeters, why don't we find one partner and leverage the scale through one particular partner? That'll allow their unit economics to come down. That'll allow us to have a partner that is willing to give us better volume discounts. And what we've done as a conscious effort is not take that as a profit, but pass that over to the consumer as a very low cost engagement methodology. So the biggest component here is aggregating a volume of products and services and then bringing an economy of scale model to it.
Okay, so you're preferring to work with large sort of population health partners versus but you're also going direct to consumer, but that's a different thought process, right?
Our process from a back end, it's the same, because if we have a glucometer and that glucometer goes to clinic in the Bronx, or it goes to Bob Smith in Boston, the mechanics behind the deployment are exactly the same. The difference is when you go and you choose which one of these supplies I'm going to provide them. If I centralize all into one brand and one big purchase cycle, then I can bring efficiencies of cost to both parties, either direct to consumer or through our efforts with bigger partners.
Yeah. What are some of the challenges of launching into telemedicine right now? It's obviously a time when adoption is historically high and there's more attention being given to it than ever before. But that also means that the market is getting more crowded. So what's it like, challenges, opportunities in launching telemedicine right now?
So I'll give you the opportunities, because for us, strangely, it was an opportunity, and everything to this date has been positive, and I'll tell you why. So when you're looking at that uptake in demand, what's happened is that the traditional providers of telemedicine have locked down their systems. So some of these providers historically would take cash pay patients. Because of the surge in demand, they're shutting that off and they're only taking insured patients, right? Because I have a provider network that I have to support as that incumbent, and I have to make sure that their volume is guaranteed. So by doing that, a byproduct of it is a lot of those patients are coming to us.
Got it.
The dynamic that we saw when the epidemic started, and luckily we were prescient in that thought process, was that we needed to create a large pool of providers quickly. So what we were able to do was we were able to go and work with the National Hispanic Medical Association, which represents 50,000 medical doctors in the US that are of Hispanic origin, as the name implies. We were able to do an outreach through their communications to all 50,000. We were lucky enough to be able to self-identify physicians who love the concept of providing low-cost telemedicine in a time of need. So we have identified at this point over 130 providers across all 50 states who are eager to be working on the platform to go directly to the consumer and provide high quality, low cost care. So our experience differs from others because of those two elements. Number one, our focus to consumers was beneficial because they're driving demand to us that is not being met. And number two, because we're a low cost provider, the health providers have embraced and adopted our model of care.
You also mentioned working with the Hispanic Medical Association. I know you have had an emphasis on bilingual care in the past. What kind of distinguishing opportunity is that for you as well? Have there been enough products in the market that have addressed the Spanish-speaking population?
The answer is simple, and the answer is no. So we have, just for numbers' sake, 18% of the population in the US is Hispanic. Less than 5% of providers are Hispanic. So there's an incredible differential there to start with. The second element that's critically important to realize is that the vulnerable populations that historically were underserved and underrepresented happen to be African American, happen to be Latino, Latina, or Latinx, however you define them. So by us going into these communities of color and providing our solution, we're actually seeing an uptake of those that historically did not have access. So the demand is there, the opportunity is there. What we are lucky to have been able to do is to create an ecosystem that with a third grade education level, you understand what we're talking about, because we demystify healthcare to these vulnerable populations, understanding that their linguistic and cultural traits have a special way that they need to be addressed in. So by us being vigilant about that, we've seen better results than historically you would see in a broader approach. That being said, everything Oi Health builds is built with English and Spanish third grade education level. So even though we are targeting, and as you mentioned, these healthcare professionals are bilingual, if a consumer that does not speak Spanish requests a consult, we're happy to provide that to them through these healthcare providers. The commonality of our approach today is we request that that consumer be uninsured or underinsured in order to be able to drive value to those who need it most.
Gotcha. So that's actually a prerequisite. It's not that it's just cheap for those who are uninsured. It's actually a required element.
We are trying to narrow it during the pandemic on purpose, Logan, because if not, we would be addressing the needs of those that have other opportunities for care, right? And what we're trying to do is during this emergency, constrain it to a subset of the population. The reality is we're also working with health insurance plans and we're working with medical providers. So we're seeing that access is being expanded through our platform. But when we, Oi Health, goes directly to the consumer, we try to make a distinction to make sure that the most vulnerable are able to use our products.
That makes sense. This question's a bit of a mental shift, but no business has been unaffected by this. How has the pandemic affected how you run Oi Health? And even though you're in the middle of one of the hottest areas of growth, telemedicine, I know that there also have been difficulties with this for you. So what's that been like?
Sure. It's been a roller coaster, to be honest. It's a great day followed by a not so great day. So the reality is, when you look at what the challenges for many companies, including Oi Health, are, is that the uncertainty in the market leads to an uncertainty in investment. And the biggest challenge for us has been an investment discussion, because ongoing discussions were extended, and there's a lot of uncertainty in the market. So when we heard about the opportunities that the government was giving out in support of entities like ours, so through the payroll protection plan and through the economic injury loans and all of those, we were excited about those opportunities, only to learn that EBITDA negative companies don't qualify, so that discounts most healthcare tech startups that are in our journey's arc, right? So we've had to identify quick pivots to be able to magnify our solution. So what we've done in our pivots have been to hyper focus on federally qualified health centers and other low income medical providers to provide our network either as a patient engagement platform, so pivot from your current operations and use ours, and where we have a relationship and a partnership, or go to those entities that do not have a way to manage those patients that are living with those chronic conditions in the community and offer them a low-cost engagement model that Medicare and Medicaid pay for. So we had to leave certain elements of our platform, which were gaining adoption and traction, and then pivot our focus over to remote patient monitoring and telemedicine in the short term to be able to be attractive to these larger institutions as a potential partner. And that's what we've been focused our efforts on. So it's financial challenges, and then the second opportunity, which every challenge is an opportunity in my book, is the ability to quickly look at what is the needed element and deploy against that. And we're lucky that we've been able to do so.
Yeah. I feel like one of the conversations I keep having is, will the high adoption, will it remain? How much will we slide back into old ways of doing things when this is all over? What do you, when you think out a year and you think optimistically about this being a leapfrog moment, where do you see OI Health? If this is really a catalyst for you, where do you see yourself in a year? What gets you excited?
I think, so first of all, I think that there has been a seismic shift in health, right? Remote patient monitoring, telemedicine was an interesting but future element, right? Oh, we'll get to that and we'll deploy it in 6 months, 12 months, 11 months, 18 months, and so forth. What's actually happened is that shifting moment has put it, this is my operating method today. And as you know, and many others know, once you have one of these shifting events, what you're going into is an environment where the new normal is reset. So my personal opinion, through conversations with many stakeholders in healthcare, is that the remote monitoring component of this is here to stay, right? Because if I was able to deploy and maintain a patient at home, engage with him or her at a distance, ensure care is being delivered remotely, no problem. Will that slide back? I don't think it will. The telemedicine component, which is the other big change that has been happening, it was mainly two bifurcated issues. One was payment parity, that's been taken care of. And the other one was consumer adoption, which we've been having a discussion for the last 20 minutes related to that. So I think that from a telemedicine perspective and from a remote monitoring perspective, we're here to stay. The question is, how deep do we go into that journey? And my personal opinion is that anything chronic condition managed is going to be managed remotely into the future, because a pandemic caused this and showed those healthcare providers that it can actually be done very effectively.
Yeah. Very interesting. Well, that's the time that we have today. Mario, really appreciate all the work that you're doing with OI Health and really prioritizing finding systems that open up access and work for really the poorest and least resourced individuals in the country and in the world. So really appreciate that moonshot that you're on and all the work that you do to make that happen.
Thank you for the time. It's an honor to be able to do this. Luckily, our team has the capabilities to inflect into that particular space. So we continue to push forward, and we're happy that you took the time today to talk to us, and we're really appreciative of everything that Startup Health does to support the Moonshot participants in your organization.
Thanks a lot. Have a great day and stay healthy, Mario.
Same to you. Thank you.